I am Shalini Bharadwaj. You all are watching ITV Network's Medically Speaking on NewsX. So today we can say it is a big impact of medically speaking as well, as one step closer, everyone above 18 will be eligible for vaccine from 1st May onwards. So we have with us on our panel Dr. Anil Kohli, who is a former president of Dental Medical Council. And then we have Dr. JAYESH LELE, who is a Secretary General, Indian Medical Association. We have Dr. RAJEEV SETH, who is a vaccine expert as well as senior pediatrician. My first question goes to Dr. JAYESH LELE. Sir, what you would like to say, because Indian Medical Association has, they also initiated you all together and requested as well as PM to start a vaccination and to reduce the age. What you would like to say?
Yeah, first of all, we always welcome the positive moves by the government, and we have been requesting that more and more people should be vaccinated earliest possible, so that the carrier stage or somebody, older people are vaccinated, but younger people are not vaccinated, and that way they are mixing and spreading the disease more and more. So rather than that, those who are active workers, they should be always vaccinated at one go. And right from the day one, we are IMA have offered all our IMA doctor services for hospitals as well as for vaccination. And we are happy to receive this welcome move by the government of India. We welcome it. Today only there was a meeting of when our national president spoke directly with the Prime Minister, and it was many health associations were involved, and where he reiterated that we are ready to work. Whatever work is assigned to IMA in any capacity, but we'll see to it that this corona needs to be defeated. Yeah.
That's true, sir. Sir, Dr. Anil Kohli, sir, what is a key part of it and how it will be done?
I will take Shalini 2 minutes. Let us go back. When we had in 2020 this coronavirus, and if you remember, when we had the number in hundreds and thousands only, and we put a lockdown. And after that, by December, January, we thought we have won the war and we are out of corona world. But unfortunately, we didn't realize the tracing, tracking and treatment part. And that was the time when the children and everybody was not being exposed. The moment the first wave slowed down, the people started going out to Goa, here, there, and it started opening up. And these people, those who were exposed, they were the carriers. And if we look into our country, more than 50% of the population falls in the age group of 18 to 40. We are the youngest generation people in the world. Now, looking on all these things, it is very, very important, because tracing and tracking is very comfortably done when you are doing in hundreds and in small areas. Now, you just take an example when we have 25,000 people getting affected every day, and tracking, take an example of 20 on one patient, 25,000 into 20, that much tracking is not possible. So what is the answer? Answer is only vaccination. But again, it is a late move, but it is a very good move. But unfortunately, we have to look into one more part, the supply. Right now, we are short of supply of the vaccine. Now we have opened up from 18 onwards. So we have to increase the production and supply to the everyone so that we can reach. I'll give you an example. I was in US, already half the population being already vaccinated. So I think we have to increase the number by providing the facility for the vaccination to the generation.
Yeah. We have with us Dr. MATHUR also, who is an Executive Director of Interventional Cardiology and Chief of CATH Lab at FORTIS ESCORTS. Sir, welcome to Medically Speaking. As well as we have Dr. RAMCHANDANI, who is an Additional Professor Surgery at AIIMS RAIPUR. Welcome to Medically Speaking, sir. Dr. ATUL, Sir, what are the key points? What do you think the government is going to start as in a meeting which was chaired by the Prime Minister Narendra Modi? It is decided that the pricing, procurement, eligibility, and administration of vaccines would be made flexible in phase 3 of the vaccination. So, what are the facts involved in it? Can you hear me, Dr.
Yeah.
Atul?
I think I have a signal issue. Yeah,
Okay.
yeah, I can hear you. Is it okay? Can you hear me clearly?
Yeah, Dr. Arun, yeah, we can hear you. Please continue.
Atul. Yeah.
Yeah. Yes, Doctor.
So the Prime Minister is doing a very proactive job, and he is trying to keep in touch with the latest happenings in the field of this pandemic, which is very important.
Sir, there is some voice issue. We can't hear you. Dr. Rajiv said.
Yes.
Sir, can you hear me? Sir,
Yes, I can.
Yeah, sir, what are the key facts involved and how they are going to do it?
So this,
You see, if you talk about the vaccination program, which is now opened up, this is a great move. We have a population of 1.3 billion, which means that if we want to create a good herd immunity, at least 50 to 60% of our population has to be immunized in the next 6 months or so, and for which we will need to vaccinate at least 4 million people per day. And this translates to almost 50,000 centers opening up, delivering about at least 80 doses each day. So you see this amount of introduction of centers, and suddenly all of a sudden, I think will not be possible unless the private sector is also roped into. And the vaccinations are the only way out under the present situation. Vaccines are the only thing which prevent disease. We have 2 India-made vaccines, and we need to certainly launch this on a war footing. The Indian Academy of Pediatrics, the IMA, you have already heard, we all stand committed behind the government for this move.
Okay.
And for whatever reason, our president has also talked about, all support in terms of human resources, in terms of logistics or whatever. So I think what is important, Shalini, is that a partially vaccinated population, like we have only 5% people partially vaccinated with only 1 dose, is basically putting us into risk, because now the virus gets an opportunity to mutate, and these double mutate strains which have come about is all very worrisome for us. We as vaccine experts know that every year a new virus mutates. We have experience from the influenza virus, and the influenza vaccine is designed every 6 months or every 1 year, depending on the mutations will take place. But we are into 1 year plus in this disease. We really don't know how the mutations will pan out. And already the vaccine manufacturers are trying to take this into account and making sure that subtle changes which they have to do in their vaccination, so that they get robust immunity against these variants as well. We have also hearing cases of people having diseases after vaccination. So it goes beyond saying that while you've had vaccination, you still need masks, you need sanitization, you need social distancing. And what has happened in the, January, February, we were all sitting calm in our offices. There hardly any cases. We had tons in supply of vaccine. Every country was admiring, WHO also admiring. But we have now have to wake up from this complacency which has happened. Probably the Kumbh Mela, or whether it was related to the elections or whatever has happened. We need to change. And I think in vaccinations, like any kind of delivery, we need to address the social determinants of health. And this is the key factors, because what we are seeing in our practice is even learned, educated doctors, professors, we have some people who still have vaccine hesitancy in them. Lots of people are not going forward to take vaccinations. So a rollout of public health campaigns to kind of inform them of no side effects, of their efficacy, and continuous approaches because the benefits of vaccination will outweigh a lot. Yes, the other public health measures like surveillance and testing and isolations and hotspots, all that thing will continue. But given our population and the huge challenges, I think this is extremely important that we have at least 50,000 centers immediately operational, given at least 80 doses per day, and at least 50% of fully vaccinated people in our country. At the same time, Shalini, if you give me one more minute,
Yeah, sure,
I want
sir.
to tell
Please
you,
continue.
at the same time, Shalini, I want to tell you that we as pediatricians, we hardly saw any pediatric patients in the first wave. But now as we sit in our offices, every third or second patient has fever. There are hardly any family which is not affected, and children are getting affected. Now, earlier we thought that, children is not something, we never had any trials on the vaccination. So this is again a challenge coming up for us as we see more children getting affected. And there's a very serious form of disease called multisystemic inflammatory disease in children, which can occur to 1 to 2% of the children, where they get severe reactions like a hyper acute phase reactant to this virus. And these children can land up into ICUs with the shock and symptoms of cardiogenic compromise. So what we really need to know that we have challenges for children, and we immediately need to process trials and fast track them for children. So essentially, children are believed to be super spreaders. They may not be themselves being so badly affected as some of the senior citizens, but we have to now plan for our children. We in India have 440 million children, and 26 million babies are born every year, and 40% of them are in remote areas where the parents themselves do not have the via media. So how this is going to be incorporated into the vaccine programs is going to be another challenge. And I think we need to be up to that challenge. We need to do planning right now, planning for few months ahead, and taking our experience. I mean, people are criticizing, and people are also saying that, hello, we can take all these vaccines to door. Come on, if you get one anaphylactic shock or one death from a vaccine, this vaccine program is going to roll back. So what government is doing, this 30 minutes observation, looking for any allergic reactions, anaphylaxis due to vaccination, is a very important thing. Just because you want to go for the numbers and you don't go for the quality is also bad. So I think we need to have both those things. And I think it is not a good idea that you go door to door and vaccinate. That some of the leaders have thought about that, but I think personally vaccination is a procedure. It has to be taken seriously, like any kind of surgical procedure, and all the safety precautions should be in place while you're vaccinating somebody. Thank you.
That's true. Thank you, sir. Dr. Atul Mathur, sir, as we can read out in a press release, which has been shared by the Ministry of Health, that the division of vaccine supply is 50% to Government of India and 50% other than Government of India channel would be applicable uniformly across all vaccines manufactured in the country. However, Government of India will allow the imported fully ready-to-use vaccines to be entirely utilized in the other than Government of India channel. What does it mean, sir?
So that is a very practical way of trying to expand the scope of vaccination. Because now from 1st onwards in the next month, the government has expanded the scope to 18 years and above. So you will need a far bigger and massive infrastructure to be able to conduct that. So now government has to partner with the corporates and the private players in this, and this is a very sensible move. Yes. To make sure that the poor and the underprivileged are not deprived. The government is taking a 50% share of the vaccines produced in the country. The imported ones are going to be more expensive, and the government will be burdening the taxpayer if they try to buy that and give it free to people. So this is how I look at. And basically this pandemic, we should look at as a wave. There is a crest and then there is a trough. So right now we are on a crest and we are on the peak of a surge. And this is the time vaccination is not that important. Vaccination has to continue throughout, and that is going to be effective even when there is no peak, because it's for a long-term planning. But right now we are in a peak of a surge. And this is the time when we need supportive care for patients who are running into hospitals with oxygen, with medication, with education of the patients that who has to go to the hospital and who should not panic and unnecessarily fill up the hospitals. And we should not discourage people from hoarding important drugs, important oxygen supplies and other things.
Dr. Ramchandani, sir, what are the challenges involved?
Madam, as the sir told, that vaccine is very important. One of the domain where through which this pandemic can be handled. But it is all about the immunity. It may be the natural immunity or it may be through the vaccines. But as the ATUL sir told, that the present crisis vaccination should be given, but not at the cost of the other challenges being at this stage. So many people, even doctors, are often not convinced. I'm saying that so many doctors are not convinced about vaccine, about the utility and side effects. A lot of doctors. Then how can we convince the peoples of India?
That's so very important.
Government should necessary steps through the webinars or the something else to convince the people. But the thing is that at the crest of this peak of pandemic, first priority of government should be to save the lives of the patients. Sometimes some people are convinced. They think that taking one dose of vaccine, it is all about that we will be out of danger from the corona. So these are the challenges being that vaccine there is a short-term plan, there is a long-term plan. We have to keep both side by side and we have to handle accordingly.
Dr. Jayesh LELE, sir, IMA is also going to play some kind of role in this process?
Yeah, definitely. We have already offered our small nursing homes wherever our IMA branches are there. Plus, in fact, at many places, we have our IMS building also. And there is a facility of storing, saving, and the vaccination facility also. But at the same time, IMA will offer whatever services are needed. That is true. They have just to tell us that in this area, suppose we need so many vaccinators, so many just doctor observers, and some place. But the challenge is going to be coming, as I see, that when we started the vaccination program, on the beginning, the vaccination was not taken up. Gradually, the vaccination took up. And at the end of the first phase of first vaccination, so that whatever the doctors were or health community workers were there, out of that, in the second phase immunization, many have dropped out. Second phase, the second dose of immunization has not been taken by them. So like that, suppose we have started dropping, we'll have to start following immediate proper reasoning. Otherwise, our entire exercise, which is a serious work of vaccination, very important. If we don't attend to that simultaneously, because we must find out why they have dropped out, whether allergic reactions have taken place, whether their allergics were serious, or they did not want to fall into that again, fever, body pain, malaise, and all those things, or whether something beyond that has occurred to them. So this second phase dropout, second dose dropout in this vaccination category, if he starts increasing like this, then we will lose the complete track on that. So, and we will just land up giving first vaccination to everybody. And at the same time, there will be a lot of issues because we have seen that second phase vaccine, those who are not taken up, they have already got corona. Many are in Mumbai now. And with the, some doctors are also getting corona because they have not taken the second dose. Many people were also there. So I feel simultaneously that this point should be attended by the proper researchers, proper statistical measures should be taken and found out the ways and means to that. As regards the IMS staff and buildings are concerned, we are ready to work and give. As a private sector, we are ready to enter also. Suppose the IMA has been permitted to buy the vaccine and save the, give the vaccine, IMA will take into consideration whatever licensing is required for that, FDA license or anything. We will prepare and see that our particular branches will take that licenses to give the vaccination license. I am ready with the.
Dr. Kohli, sir, what you would like to say, sir, about this particular phase 3 vaccination, which government is going to start?
I will take 3 points into consideration. Now, any disease or anything when epidemic like this comes up, first of all, we have to look into bringing the awareness among the society. Bringing the awareness, I mean, when this epidemic came, we all thought it's a droplet infection. But now it has been proved it is an airborne infection which spreads more faster than the droplet infection. That is number 1.
Yes.
Number 2, you have to maintain the 2-meter distance and use of the face mask, and hand cleaning is very, very important, and people has to be made aware whether you are traveling, whether you are driving, whether you are at home. So this is the first very, very important thing to bring the awareness among the common people. Okay, you have to live with the new norms in the life, and which will go a long way. Number 2 point comes the prevention. Now, what is the prevention? As other panelists told you, it is only vaccination, which can bring the prevention in the society. Now, the problem in vaccination, how much we need the vaccination about the production, because only 2 or 3 companies are allowed in this country. And when they manufacture, they have to give 50% to the people from where they are being authorized abroad. So that is also misconception. Our country is giving them back or giving to the other countries. We are bound to the rule that when you are manufacturing in collaboration with any other company, the rest of the material has to go back to that company. So we have to increase the production, and we have to allow another vaccinations from rest of the world, as you rightly said, to come into the country so that each and everyone is vaccinated, which is going to take time, looking at the huge size of our country and 1.4 billion population. And not the last and the least, then comes the treatment part, our medical system, for which we have to gear up, as doctor said from Medical Association. You need to increase the number of the beds, supply of the oxygen, and all these things have to be strengthened. Only thing we have lacked into when we knew the epidemic is coming, but is never late. We are not going to lose anything. Even from today, if we start working on it, we are going to face it, fight, and treat it well, as we have done in the past.
Dr. Atul Mathur, sir, how many people need to get vaccinated if we talk about to obtain herd immunity?
See, you need a lot of people around for this virus. They say around 60% people should have an immunity. So I think a significant number of people have already been affected by the disease itself. Now, whether getting COVID infection gives you a long time immunity or not is not very clear right now. Even whether the vaccine will give you an immunity for more than 6 months or 12 months is not clear right now. But at a particular point of time, combining the immunity due to the vaccine and combining the immunity due to an acquired infection of COVID, you need at least 60% of the people of the particular region to have these antibodies or the protective T cells in the body to be able to remove the virus from the community. So that is how you would look at, and this explains how far away we are from achieving that kind of a herd immunity, because you have renewal of refreshing of patients after 6 months or 12 months, and then you again need to give them immunity to this virus because the virus has changed its sequences and its shape and the way it works on your immune system. So it is going to be a challenge we are going to face for the next few years. And we have to make a good plan for the long term, for the next 2-3 years, and not short-term plans, which once you find that the virus load is down in the community, so you dismantle all your infrastructure, and then again you see the virus is surging, and then you start putting up your tents and beds and oxygen cylinders and everything again. So we need a long-term plan for this.
Dr. Yes, sir.
Shalini, Shalini, thank you. You know what Dr. Atul said was absolutely right. I mean, if you have to reach herd immunity, one thing we need to be mindful that India is not located in Delhi, Kolkata, in Mumbai, and these big metros. A large section of our population lives in the villages and also in the slum locations and marginalized communities. And that is where the real challenge lies. You know, while we're talking of fast tracking the vaccination drive, we also need to make sure that this vaccination is distributed evenly out to even these remotest corner of the country. And my experience of working in Mewat, which is an aspirational district about just 80 kilometers from Delhi, I've seen the struggle is addressing the social determinants of health and to vaccinations. Because in our culture, it's the mother-in-law, it's the senior elder male patriarchy society that we have who decides what to do or not to do. There's a lot of issues that we need to tackle. Also, once a rumor starts, it's through the social media, it goes on and on. And I don't want to get into the negativity part, but I think these issues have to be sorted out. And there are lots of people who actually take advantage of these situations, and lots of fake news has been perpetuated all around. You see, since we have all the doctors here and the government has now decided to launch this, we need to support and we need to fast track. As a nation, we have an opportunity to rise up to the challenge. I'm really proud to be an Indian today, and all of us should be, because we have vaccinations made in India. Original research from the ICMR, National Institute of Virology, the Covaxin, and also the Covishield. And the government is licensing all the foreign-made vaccines to come in. Other players are coming in. But what I really want, that we need to be fast on research. And this is where we are lacking. Research and development is very important. A research program to look at genetic sequencing of these viruses. Very important, because as you have seen, we were sitting cozy and then the British variant came and the South Africa variant came. We don't even know whether...
If we would have been doing it, genome sequencing, then definitely we would have taken so many steps.
Certainly, but there's never too late, even if you start now, because you can then track which vaccines are working, what upgradations you need to do in your vaccines, how we can actually get higher efficacy out of a vaccine program. And these are very, very important things, planning ahead. And the lastly, what I said is about children. Never forget them. They are super spreaders. Although there's no trial now below 18, so we are not licensed to give this, but the Pfizer vaccine has been shown to be good in little younger teenagers as well, about 15 years or so. So essentially, as more research comes up in children, the safety protocols, that's one. The other is that the people who manufacture Covaxin are also considering using a nasal vaccine. You see, if you give a nasal vaccine which goes into the nose, this virus is, as you said, if you're able to target that, the nasal vaccine will be very easily to given, can be given by less training, with less hassles. But again, that's on pipeline. So the research needs to be fast tracked. So we are very proud to be in India, and amongst the developing nations, we've already exported 65 million doses as a vaccine diplomacy out. It's nice to share, but we also need to look into what our own internal needs are. And also, I just came to know that there's some of the raw materials are not being shipped from bigger countries like the US. So that's the reason that some of our Covishield manufacturers are suffering. These glitches are something can be done at the national political levels. So, and the manufacturing people are given all the funds, all the human resources or needs, so they can build and upscale their capacity. And then comes the fast tracking, looking at social determinants health, getting private public partnership models. And we need to ensure that this reaches to the remotest corner of the country. Herd immunity is a distant goal of 60%, but like we already had so many diseases going on, and possibly we already have some antibodies around, but we need more research, we want data. And also, yes, and besides vaccine, one thing we must remember, till this period of time, we don't have a single antiviral drug. There's not a single safe, well-proven, efficacious drug for this virus. So that research has to go in that. And And today, India is proud that we have great scientists, we have research labs and world-class facilities. We were the first developing country to come up with 2 state-of-the-art vaccines. So I think more investment has to go into research and development of these. And so that, because it's not possible for private players to do so much of research and R&D. Only 5% of our population is immunized by 1 dose compared to the US, which is 32%. Israel is 60% fully vaccinated. So they have a herd immunity. And today I saw a news that the Israeli government has told no mask for their community. You could go out without a mask. So, you know, lots of countries are reaching, but those are smaller countries. Our population is big,
A
diverse.
highly densely populated country.
Exactly, high density, socio-cultural and other factors. So essentially, I think we need to all work together. That's the only way out here.
Dr. Jayesh Lele, sir, one question is still, you know, I wanted to clear that, which is completely unclear in this particular release also, that if somebody wants, who has below the age of 45 years, wants to get vaccinated, then that particular beneficiary, where she or he has to go, that means it is available over the counter or at the same centers which are like private hospitals or government hospital, where our beneficiaries should go? I can't hear you, sir.
I think in the Arogya Setu app, they have opened up a web page for registration of those people, because there will be so much of crowd asking and rushing in for vaccination. And at the moment, already there is a, when we are telling social distancing, already COVID patients are there, and simultaneously, if we ask the other crowd to enter into the similar area, will cause a lot of problem. So they will.
But that particular app is already not working properly. Then and we are
No,
starting a phase 3 trials. It's the biggest challenge.
No, they can always go and see that they can ask them to register at least on a in the Mumbai, a small place like that, particularly municipal corporations in a particular area wise, they can ask the distribution.
Okay.
Those age group wise, you mean to say that? So age group wise, they should register themselves, and accordingly it will be given. Say for example, if it is in the Mumbai area, in Mumbai there are 23 wards are there. So all those wards, like in a council, there will be wards. In the corporate also there will be corporators. So like that, accordingly they will be submitted and given particular kind of a registration. And otherwise, again, there will be crowding if you just open up it and somebody just walking and giving a vaccination. Unless they have enough centers, then there is no problem that you go to the nearest area, which is about maybe half a kilometer distance, and he's ready to go there.
That means we need to rope in more and more centers.
More centers first, unless the centers are created, huge centers, I mean. As the doctor has already explained the amount of centers we need, huge centers. And yes, there is possibility all in this war, all the private doctors, small nursing homes. Now, when we know that no major reactions have taken place, so small nursing homes will be definitely more than willing to have some facility for vaccination center. And if we open up so many vaccination centers, then it will be definitely reducing the burden on and the crowding. So that is what their plan is, according to me, that they will open up the centers so much that the crowding will go down, and then the vaccination for this 18 to 45 group will be facilitated.
Thank you. Thank you so much, Dr. Rajeev Seth, Dr. Jayesh LELE, Dr. Radhakrishnan Ramchandani, Dr. Atul Mathur, Dr. Anil Kohli for joining us and doing and sharing such a important information with us on medically speaking. Thank you so much, sir.
Thank you.